I'm Dr. Inderpal Singh, and I'm a consultant geriatrician. I'm working with the Narrated University Health Board. I'm also a national clinical lead for falls and frailty. Within my national role, one of the remit is to improve bone health in Wales, and we are producing this series of video and doing an introduction to raise the awareness and education on osteoporosis. And there is no conflict of interest or anything to declare. I would like to thank Hughes-Williams for supporting me. So I'd like to start with explaining what is osteoporosis. The original bones, which are very thick, have a good structure part of this, and they're very heavier. But if you look at the bones, which are osteoporotic, they're very thin, distorted structure, and the quality of bone has been affected. And very easily, the height of that bone is also reduced. It's a very thick bone here, and that bone is also already breaking, and you can see a small chipping part coming out of this without any force. So if we do have a very low impact on such bones, like a fall or even carrying something really heavy, they can easily break. And hence, this is known as osteoporotic fracture or fragility fractures. Most often, we get these fracture following a fall. We can have a fracture in our wrist. We could have in an arm bone, which is a humerus bone. We can get that in a hip or pelvis bone or in any part of the spine. All these sites are simply classed as osteoporotic fractures. I'd like to share more about the few myths and some risk factors we have. Myth is often that it affects only the older, frail woman, but that's not correct. And it also a myth that is affect only with age and only the older individuals. It can affect anyone, but it depends on the multiple factors, and these could include in the family itself, could be in the environment, sometimes related to the medical conditions, and sometimes to the drugs. There are some unknown factors which we don't know, but we need to start thinking that why those particular individuals have osteoporosis. But the most important part is that how we investigate and diagnose them. People often ask, how common is osteoporosis? Will it affect them? And if it does affect, so what? How will it affect them? So I think it's simplify to say that how common it is, that at this moment in UK, there are 3.5 million individuals who are living with this condition. And as per more recent studies, and based on the guidance, every minute in the UK, somebody can have a fracture as a result of osteoporosis. So to simplify the risk, in women after the age of 50 is 1 in 2, and men it is 1 in 5. So based on the recent reports of the National Hip Fracture Database, previously in the year 2020 or 2021, we have observed about 67,000 fractures in a year. But for year 2022 gone, we have observed 72,000 fracture, which is an increase of extra 10% hip fracture. There must be several reasons contributing to this number, partly COVID, but unknown factors, and we are still trying to find out what else needs to be done to know and minimize this hip fractures incidence. There are several risk factors which we have. Could be medical conditions, could be drugs what we are taking, could be related to the genetics or environment, but also based on the personal choices. If we are drinking alcohol, which is above the limit of recommended units, or it could be heavy smoking. So if we talk about the medical condition, it could be related to the hormones, could be like endocrine glands, or it could be bowel problems like celiac disease, or it could be just simply medication taking like steroids. We often discuss about the impact of osteoporosis on an individual, and a simplest answer is an unmeasurable impact. For example, if somebody had a fracture, it's not the pain they're living with, or they're not able to do the work or their function routinely. For example, if I had a fracture of the wrist, I can't wear my turban, can't come to work, or somebody had a fracture of the spine, which could be here, and they're living with that pain after that, they cannot come to work, or they cannot do their routine activities. But in addition to that, it also leads to the huge fear of having a next fall, hence another fracture. It also leads to the loss of confidence in those individuals. And when we look into that part, it carries into a vicious cycle where people stop walking around and doing exercises as we normally expect them to do. And hence, there is more loss of the muscle strength and hence more fall. So when we look at this vicious cycle, many times we have observed the individuals after having a fracture stop coming out of their houses, going out for any exercise or any type of social networking. And that impact is not measurable. But many a time, people after having a fracture require a need of a care home. Sometimes they are admitted to the hospital for a very longer duration, and sometimes they do die sadly. But these are the things which we cannot measure. So sometimes the family or a carers have impact on their own life. They couldn't able to go to work and have to take time off from the work and to look after their loved ones. And if we put it all together, it's not simply a fracture cost to NHS, it's the impact on a community, on an individual, how they're going to live their rest of their life after having the fracture. We should invest in primary prevention like we do for any condition. So we like to do that for osteoporosis as well. And the way to do that is identify those individuals who are at a higher risk of having a fracture in their life based on their medical condition, their previous history, taking any particular drugs or personal habits, and we try to improve on that. However, considering the constraints of resources and staffing, training, and different requirements for the different individuals, we are thinking on the prudent healthcare principles. We are going to invest in those who needs more care. Hence, in Wales, we have opted for a secondary prevention first, and later on, we will be going to the primary prevention. This is also in line with Department of Health guidance, in which we have to focus more on those individuals who had fracture of the hip, followed by those who had non-hip fractures. We are working very closely with the communities, Public Health Wales, to avoid falls in those individuals and helping them to have a more independent living, particularly in investing in exercises plan and a self-care plan. So in Wales, our priority is for the secondary prevention at this moment, and we are working to identify those individuals. Hence, we can commence a care plan for osteoporosis and monitor them as based on the recommendation of the NICE guidance and a fracture layers and services database recommendations. In Wales, we have developed partnership working with several organizations, including Royal Osteoporosis Society, and we are working collaboratively with all the Welsh health boards. All medical directors, chief executives in the Welsh health boards have agreed in principles to support the fracture layers and services in Wales. These services identify those individuals who had fracture and attended our hospitals. And these services help us to identify and then start a treatment plan for osteoporosis for these individuals. These services monitor these patients very closely, educate them on osteoporosis, and make them aware of the consequences and risk of having further fractures. These services able to assess the risk for falls and also help them to understand the importance of muscle strengthening and balance training exercises. After having a follow-up at 16 weeks and 52 weeks, we work in partnership with the primary care teams, and the care is transferred to the primary care colleagues for the further follow-up. People often ask where we are with the fracture-related services in Wales. And I'm pleased to share that we have done our first inaugural fracture liaison conference in Wales last year. And our Welsh Health Minister opened the conference and made a very clear mandate that these services should be established in every part of Wales so that we have 100% coverage in Wales for these services. We have got a huge burden of fractures every year coming to our hospitals in Wales. And this number is 30,000. We do not have capacity to meet that demand as we speak today. However, all health boards are working very hard to establish these services in Wales. Based on the current guidelines and recommendation in Wales, we should identify 80% of these individuals and continue to treat 50% of them and monitor 80% of those whom we have commenced treatment. We have set up very clear and high targets for us and how best we can serve Welsh population. Welsh government and all the other health boards are fully supportive of this. We would also need help from the community in raising education and awareness on osteoporosis. The whole idea of doing this talk today is to raise the awareness and education on osteoporosis. And I'd like to highlight again that as a result of these fractures, all individuals could be at a risk of having a next fracture, but we should be investing in primary prevention, which means we should start thinking of having a very healthy lifestyle, avoid smoking, drinking alcohol as per recommended guidelines of 14 units or less. If anyone has got medical conditions which could increase the risk of osteoporosis, please continue to follow up and link with your healthcare professionals, GP or specialist. There could be some medication which increase the risk of osteoporosis. To be aware of those medication and work with your healthcare professionals to see how we can minimize the side effect of those medications. If you have been advised to have these medications for osteoporosis, I would strongly recommend to take them religiously, regularly, and a regular annual follow-up with your GPs.